My name is Dr. John Schnorr. I'm a reproductive endocrinologist in Charleston, South Carolina, where I have the pleasure of being the medical director of Coastal Fertility Specialist. I'm also the division director of reproductive endocrinology at the Medical University of South Carolina.
I'm Ken Mosestian, Executive Director of the American Fertility Association, and it's my pleasure to be here with Dr. Schnorr today. So, Dr. Schnorr, how does regular IVF differ from donor egg IVF?
Well, actually, they're kind of a blend of the two. So really, donor egg IVF for the donor involves that the donor goes through infertility medications as an infertile couple would during an IVF cycle. So the donor is generally screened to make sure that she's medically healthy, to make sure she doesn't have any sexually transmitted diseases, to make sure she doesn't use drugs. There's generally some genetic counseling that goes on along the way and some psychological counseling to make sure that she's a healthy donor. And once you know that she's healthy, we then put her on medications to help make more than one egg on the ovary. Ultrasound is used to monitor egg production within the ovary, and once the egg production is maximized, the donor then undergoes an egg retrieval, generally under anesthesia. While she's asleep under anesthesia, an ultrasound probe is put into the vagina, a needle is then passed into the ovary where the eggs are removed from both of the ovaries. Those eggs are then given to the infertile couple and used by the infertile couple to help them conceive. The donor generally wakes up well from the anesthesia, has minimal cramping and discomfort. She has a period about 2 weeks later, and her body gets back on with the normal reproductive cycle. The eggs that are retrieved are fertilized with sperm, and then the resultant embryos are generally grown for 3 to 5 days, with the embryo or embryos being transferred back into the uterus once they're fully developed. I think this is an important thing to think about in donor egg treatment is what's the most common complication from donor egg treatment. And there's no doubt about the most common complication being multiple pregnancies. Young eggs make very good eggs, which make very good embryos, when very good embryos make very healthy pregnancies. And if you put too many embryos into the uterus, you get into a complication of too many babies. And a lot of couples will come in with a long history of infertility, having used their own eggs and having 4 or 5 embryos put into their uterus at a time, and then they come into a donor egg cycle after that didn't work and are thinking also that they need 3 or 4 embryos put into the uterus. And reality is, in donor egg treatment, the embryos work so well, what we need to do is spend a lot of time with couples talking about the many benefits of an elective single embryo transfer, which is electively just putting 1 embryo into the uterus with any additional embryos being cryopreserved, because an elective single embryo transfer in most cases will still result in about a 50% chance or higher of pregnancy, with the beauty being that if you get pregnant, you generally have 1 baby at a time.
Dr. Schnorr, could we talk briefly about cost
Right.
for patients who are going to undergo this treatment?
Donor egg treatment is probably one of the most costliest forms of infertility treatment we provide. And it's because we've gotten a third party now involved. So there's cost associated with screening the donor to see if she has any genetic disorders, to figure out what her egg number is, for psychological counseling, for sexual transmitted disease testing, and for drug screening. All those things have cost to them. We then need to reimburse a donor for her time from going through the egg donation process. There's then cost of anesthesia, embryology, and embryo transfer. Costs are going to range throughout the country between about $15,000 to about $30,000 or sometimes even more per treatment cycle, with pregnancy rates ranging between approximately 50% per treatment cycle pregnant to probably upwards of 75% pregnant per treatment cycle. If you were to step back and say what's the most cost-effective form of treatment for a patient 40 years of age or above, in most cases it's going to be donor eggs. Even though donor eggs is more costly, the pregnancy rate is so much higher that it becomes the most cost-effective solution for them.
Doctor, what about disclosure issues to families, friends? Could you explain some of the issues involved with that?
Right. So a common question that a patient asks me is, should they tell their child or not that they're from donor eggs? And there is no right answer to that question. There are professionals who can meet with you and talk to you and help you understand the issues associated with disclosing and the issues with not disclosing. And ultimately, that's a very personal decision.
Dr. Schnorr, to sum up, what do you think the future of egg donation is?
Well, that's a really interesting question. There's been some really neat advances over the last 3 to 5 years in actually egg freezing. So we've been able to freeze embryos now for about 30 years successfully. But freezing eggs has been more difficult because the egg is larger in size. It has a large cytoplasmic area on the inside that has about 60% water in it. It's got unique structures called the zona pellucida on the outside that's important for fertilization. It's got a cytoplasmic skeleton on the inside that moves chromosomes around, and all those things are very fragile and have been hard to correct with egg freezing processes. But over the last 3 to 5 years, there's been a new freezing process called vitrification, which is a way that essentially we can flash freeze an egg, which appears to lower the damage to the egg with the freezing process and improve pregnancy rates. Which, if you think about it, is a wonderful advantage for women who might be trying to delay reproduction because they haven't yet met the man of their dreams, or maybe women who have new diagnosed cancer and they're going to get chemotherapy or radiation therapy. But if you use these same egg freezing technologies for egg donation, it gives us many, many advantages in egg donation. It allows us to have egg donors available to you in any individual city from all across the United States, where literally eggs could be frozen in Seattle and used in Charleston, South Carolina, or used in Florida. They can be collected and frozen and used next month, or they can be used 5 years later. But the biggest advantage is the immediate availability of eggs, the broader selection of eggs, and that you can use a smaller number of eggs, generally with egg donation in a frozen cycle than in a fresh cycle, allowing that resource to be used more ubiquitously. Okay?